I'm Scott Willms. I'm one of the orthopedic residents here in Saskatoon. The nice thing about going last is I didn't have to come up with any of my own ideas, so you've probably heard a lot of this stuff already, but I'll just go through it. My project was mainly on osteoporotic care post-fragility hip fractures, and I'm continuing to work through it. I've learned a lot along the way, and these are just a couple of my ideas. So some of the reflections was just like my theory behind the QI. So learning a lot of the knowledge, I think, is really important because you got to be able to talk with certain people and sort of demonstrate those principles as you learn. It allows you to sort of analyze the problem correctly and then go from there to correctly solving it. Leadership, I think one of the main things that I learned too is that you don't necessarily have to be at the top of the totem pole to learn how to lead. Being a resident and talking to a lot of my staff about this, that was something that was challenging at the beginning, and learning how to sort of traverse that was important for me. I'm thankful for just staff that are very willing and respectful towards that and the breakdown of sort of the totem pole and hierarchy. Some of the other big thing was your passion for your project really matters. I think you have to be excited about what you're doing, and you have to demonstrate that to other people for people to really latch on to your ideas. And so I had to, just being really enthusiastic about what I was doing allowed me to really, I guess, communicate those things to other people. My biggest breakthrough, I think, came when I started to realize that I had to kind of go against the grain a little bit to come up with the correct idea to finalize, to get the solution for my project. I worked a lot with Dr. Johnston, and it was just valuable to have his sort of input and how to go about doing this and to use different ideas than he had tried in the past for trying to improve this sort of problem that we dealt with. The most successful moments, I think, is just watching your hard work pay off. I had a story where one of the staff physicians reached out to me and just was sort of asking me what to do for patient care around osteoporosis, and that just sort of showed me that having the knowledge and sort of working through all this really helped me out a lot, and that showed me like the success that I was having. And then the most challenging is that change is slow. I think the more people that you try and impact and the wider you make that net, the longer it takes to make any changes. That's definitely something I've noticed, and trying to make this across divisions and even multi-divisionals and trying to involve rheumatology in this has really slowed down the pace quite a bit, and I think just learning to roll with that is important. Plans for my ongoing development, I think I'm going to continue to develop my project. That was always my goal from the beginning. I knew that I probably would not finish this in 9 months, and that I continue to sort of take this on while I'm a resident in Saskatoon. I want to continue to pursue other projects that I see rather than just having that mentality that, you know, we don't have the responsibility to necessarily change things. I think it is important to find that responsibility and to do those projects. And then just combining what I've learned about quality improvement with another passion of mine, which is medical education and surgical education. So learning how to incorporate these, I think I've seen a lot of similarities between that. So as I pursue that, I'll just continue to sort of use and rely on what I've learned in this project. So thanks very much.